So we'll get started. So this talk is about the DPDP Act. That's the elephant in the room. We all want to share data. We all want to build models. But there is a legislation that is like the Damocles sword on us. So what do we do? Okay. So what are the implications for healthcare? So to carry forward, so this is the outline of my short talk. To quickly go to the genesis of this act, the DPDP Act. Then we go to the main provisions, challenges for healthcare, a quick comparison with another legislation that's present in the European continent, and then what can we do to mitigate the situation. Some proposals that one might consider, and then quick summary. So what's the genesis? So the genesis is again privacy, but unfortunately privacy was not explicitly stated to be the part of the fundamental rights in the Constitution. So what happened, the initial years, the judges interpreted the Constitution in a literal manner, and they contrasted the right of the state with the right of the individual, and then they approved that some of the intrusive rights of the state were allowed. So privacy did not get a primacy in the scheme of things. So in 1950, when the Constitution was launched, there was no mention of privacy. 1954, these are all Supreme Court judgments. So Supreme Court said no, privacy is secondary. Again in 1962, they said police surveillance is good, it's fine. Privacy is secondary. Then again in 1975, state interest was again given primacy and privacy was not. And in 1997, then is where things started to go a little bit on the other side, because now the state was also tapping phones, and this included personal information, and that politicians were also getting caught in this. So things started to change. So in the 21st century, what happened is that Aadhaar came. And when Aadhaar came, government wanted to leverage the personal information, and there was a huge suite of litigations, and they were clubbed and they were heard. So privacy and welfare delivery were the two issues. So the government did give the right for welfare delivery to the personal information, but in a limited manner. And then that was extended again in 2015, and then in 2017, when there were a lot of litigations piling up, then they all clubbed together, and then this became the famous 2017 case in which the court ruled that right to life, personal liberty, these are all linked to privacy. So if you have to live a dignified life as a citizen of India, then privacy has to be treated as an intrinsic part of that right. But it also said that privacy is not absolute; it has reasonable restrictions where national security and allied issues crop up. So this is the background against which the DPDP Act has been framed. Previous to this judgment, all kinds of privacy issues were under the IT Act. Okay, so it was dealt through the IT Act, and then you had this 66A and other kind of things where you got embroiled in legislation. So now let's come to the DPDP Act. What is the broad framework of this act? So objective is to provide a comprehensive legal framework for governing the processing of personal data of individuals. That's the broad idea of this act. And there are several players in this. One is the person, the individual who is giving the data. It's called the data principal. And then he's giving the data to the person or institution. That entity is called fiduciary. The fiduciary itself may process the data, or it may actually give out the data to somebody else who is then the data processor. And then there are a set of regulatory entities. So these are like the data protection authority, the data protection officer, the consent giver. So as we go through these slides, we will come to them. And DPDP Act is, the applicability is only in India. It is not extraneous to the country. And then the effective date is 2024 onwards. Still now, not many of the provisions of the Act has been, notified. So there is a lot of cloud, gray areas. So we don't know what to do, whether we should do this and it should land us in trouble. So this, presentation should give you an idea that what you should do in this, time frame, that you don't land yourself in trouble. Okay. Once things gets notified, you have a clarity, right? What to do, what not to do. Till that time, you can treat this as, as some minimal information that you should be aware of, not get into trouble. Okay. So now the 7 principles of the DPDP Act. Okay. So the first is the consented, lawful, and transparent use of personal data. This is basically a legal framework. And then there is something called a purpose limitation, which means you can take the data, but you cannot use it for anything and everything. You have to use it for the purpose for which it has been obtained. Then there is called data minimization. The data minimization means that while trying to gather data, you have to gather only sufficient data for the objectives for which it is being gathered. Then there is data accuracy. So data accuracy means that if you gather data and then there are errors in that data, you have the right to correct it, or in some cases you can also erase it if it is absolutely. Then there is something called storage limitation. So what is storage limitation? Which means that you can store the data as long as it serves the purpose for which it was taken. You cannot keep it indefinitely with you. That's the storage limitation. And then there is accountability. So accountability means that you have to comply with the laws of the land, and you must respect the privacy and other clauses that are enshrined in the Constitution. And then reasonable security safeguards. Okay, so these are digital things. So obviously they can be tried by anybody. You have to maintain reasonable security safeguards. So these are the 7 principles of the DPDP Act. This is what it is. Okay. Now let's quickly go through the entities who are involved in this act. Okay. So who is the data principal? As I said, is the individual who has consented to share the personal data, has the ability to provide or withdraw consent for data processing, and can seek remedies in case of data breaches or misuse. So this is your right. If you happen to give data, so this is your right. Okay. So if such a situation arises where your rights have been violated, so you can seek for corrections, erasures, data portability, which means you can seek to transfer the data from one fiduciary to another fiduciary. That is also possible. Okay. Focus on correction, erasure of records, and requires fiduciaries to notify the data protection board and affected user in case of significant data breach. Which means if something has gone wrong with your data, it is the obligation of the data fiduciary to notify you. It should not be that somewhere in future suddenly you find out, oh God, something has happened. So this is the requirement as per this act. Okay. So who is the data processor? The data processor is an entity who processes data on behalf of the data fiduciary. The fiduciaries may not be competent to process the data by themselves. So data processors will do that. Okay. And it will be under the instruction of the data fiduciary, which means that the data fiduciary has the obligation to lay down the guidelines or the framework under which the data processor can actually use the data. It cannot just work on its own. That is also there. Must implement the security measures, protect data, and typically bound by contractual obligations. So, just something that you have to keep in mind. Now there is a provision for data protection officer. So those were the entities who were previously we saw somebody giving data, somebody keeping data, and somebody processing data. So now we have the additional entities in the Act who are responsible for its compliance, regulation, and other tasks. So there is a requirement for a data protection officers to be present in such cases where the data fiduciaries are large, which means if you are an organization which is storing large amount of data, it's mandatory that you have to have that data protection officer to be able to undertake these activities. Okay, what are the roles? Must monitor to the adherence of data protection laws and policies. It will act as a point of contact for data subjects and regulatory authorities, provide training and guideline, and also comply with the law of the land. So some of the requirements that are needed has to be fulfilled by this office. Okay. So this is a unique feature. It's called consent manager. This is another part of the DPDP Act where this person or this entity is a facilitator, which means say I am a data principal, I have to give out the data, and suddenly I find that something has gone wrong with my data, I find out, and I am contacting the fiduciary is not responding, right? So the consent managers who are registered with the Data Protection Board, this is a central board that will be notified by the Government of India, nothing of that sort exists till date. So then that person, will be responsible managing and overseeing the consents given by the data principal. So that person knows, what consent was given, what was not. He will try to facilitate the entire thing. So it will serve as a centralized platform for individuals to grant, review, and withdraw that consent, simplifying the consent management in the digital ecosystem. So doctors have to be mindful of the consent managers in times to come, because they are going to be like a policeman who will check, between the data giver and the data taker if something goes wrong and try to facilitate. And that is why they are also being seen as a central, players in easing the compliance burden on businesses. So doctors would be obviously businesses in this case because they are gathering the data. They are the data fiduciaries, right? So these are the roles: ensure the consent mechanisms are clear, transparent, in compliance with legal standards, maintains records of consent provided by data principals, facilitates withdrawal of consent when requested. Now coming to the violations. Okay. So if for some reason there is a violation, okay, what is to be done? Okay. So will be a central data protection board of India, which is yet to be notified. So any violation or the breach has to be notified to this board. Okay. And then depending on the seriousness of the violation, okay, it will have to cough up a fine, which is up to 250 crores. The interesting part of it is that this money does not go to the data principal, it goes to the consolidated fund of India. The government earns the money. Okay. So these are the stakeholders, the user, the companies, and the data processors. Obviously, the large data processors will be the ones which have the onerous responsibility of being very diligent. This Act also permits cross-border data transfer. So tomorrow you want to send your data to other countries, it's allowed. But the insurance, the compliance have to be maintained such that there is no breach. Okay, so those standards have to be met. So that was a brief on the DPDP Act. So now that we have the background, let us come to the impact on healthcare. Okay, I have not written everything explicitly here. The reason being that I want to only speak, don't want to codify all these things because these are suggestions. Okay. So now, consentful, lawful, and transparent use of personal data. This is fine. Okay, as per law, this is fine. Now comes purpose limitation. Okay. Now I have gathered the data. I want to do research, right? So I can see that there is, very good trend in the data for something else that I can discover. So I cannot, use that data and publish a paper, and tomorrow that fellow finds out he's used my data and is publishing something else. He can actually come and charge me. If you didn't collect, did you tell me that you're going to do use this data for that purpose? He can charge you. Okay. So this is purpose limitation, and this is still not defined in the act. Okay. So which means that if you have to now, in the current situation, you have to use the data, then you have to say to the data fiduciary who collected the data, the hospital, that please, I have found something interesting in the data, can you go back to the ethical committee and get their approval? Okay. And if the approval comes, then you can do that. If the ethical committee deems it fit, you can ask the data fiduciary to send a message to all the data providers that look, now it is being repurposed for another thing. So that is required currently. You cannot simply use it for anything else. Then is data minimization. So data minimization means you have a patient, okay. Of course, as per the ethical committee recommendation, you have to only collect a set of data points, right? You cannot collect any other data point. But the fact is that in AI, the more the rich the feature set, right, the better the chances of having a good model, right? So these are conflicting, criteria. So which means that, once you start, and then you would obviously think that you would have to expand the scope. So then you have to intelligently, reframe your studies, right? So that is a big, hindrance there. So these are limitations that the DPDP Act has posed on. Data accuracy, yes, if there are errors in your data, you should be able to rectify it. You can call the patient back, or you can do some things that are needed. Storage limitation. So storage limitation tells you that you can keep the data only as long as it has served the purpose for which it was gathered. Now the fact is that the study that you did, for which the data has been gathered, it has been analyzed, it has been published. Now the Act says that you have to clean it up, which means that all the data is lost, right? All the data is lost. Even say if the person has died, right? The data principle doesn't exist, right? Which means that you cannot hold the data. That's a big, again, impeding factor. Accountability is fine, and then reasonable security safeguards are also fine, right? So these are good issues. So how can we mitigate this situation? So what are the suggestions? These suggestions are not only mine. I work with doctors, so they have also, they are thinking how to mitigate. Okay. So in Europe, in Europe, what they have done is they have said that medical data, when it's collected, it's de-identified and anonymized, is no more personal data. Okay, so it no more is under the category of personal data. But such clause still is not included in our Gazette notification. Okay, so explicitly de-identify anonymized medical data is no more a personal data and exempted for DPDP. If this clause is brought in, many of the issues can be solved. Relax data minimization rules to facilitate research, especially in comorbid risk conditions. Right? You're gathering data, the person has another, disease, you can see there's another variable, very interesting one you want to collect, but your hands are tied, right? So if this is relaxed, this is very good. Give exemptions for cases that contribute to improving medical diagnosis, acquiring secondary opinions, expediting patient care, modifying patient care, improving prognosis, as seen fit by the data fiduciary. If that flexibility is given, then also many things can be enabled. Because this is all data-driven science, right? The better the data, the diverse the data, the better it is for you. Improve accountability, reasonable security safeguards to increase trust with the data principles. So the point is, you are giving me the data. Okay, if I become the Tata fiduciary, the Tatas have a lot of trust, right? Because they are very loyal and faithful to their customers. So if you also do, if your conduct is very good, exemplary, maybe you can gather more data in a more relaxed manner. You will not have complaints, right? Because the litigations will come when data principles complain, right? Till that complaint is lost, everything is hunky-dory. Increase education for responsible data use and compliance. So for all of this, a lot of education is needed, because just as is, we are not aware of many things. Okay, so this is a comparison with the GDPR. So actually, the DPDP Act is heavily borrowed from this GDPR. This is General Data Protection Regulation that is currently enforced in the European Union. Okay. A lot of things are borrowed. Even the principles are very similar. So scopes are also very similar. Although EU regulation is global, ours is only Indian. Rights are very similar. Consents are also very similar. Data breaches, accountability is also similar. Enforcement. In enforcement, they have a body, we also have a body. Fines, there is more strict fines. So it is up to 4% of annual global turnover, which means if it's a big data fiduciary, a lot of billions of dollars can go. Cross-border transfer also similar. So in a way, they are very identical in their operative structure, but this is a more tight law and it is well laid out and described. Currently, our law is again done by the MIT, and it has only e-commerce and all those kinds of entities where they get into problems. Those kinds of entities have been addressed. So I will summarize. So the DPDP Act provisions are not drafted keeping the research, technology development needs and healthcare community in mind. This is clear from the cabinet notification. If you have the opportunity, please read. Consequences in case of disputes in concentrated sharing of medical data with clinicians for responsive advice, consultation, research, etc. is not clear. Okay, which means that if you have sent your health details on WhatsApp to a doctor, and doctor tomorrow has gathered so many of data records and published a paper, and you finally said that one image is from you, and the doctor gets into trouble, then of course he should know what is the background, right? The growth of digital technologies, the level of detail one must describe the purpose of data use for research and technology is not articulated. Which means if I have to describe a purpose, okay, what granularity should I describe? Okay, because you can describe in some granularity and under the hood you can do a lot of things, right? So this is not yet very clear. So you may think something and you can get into trouble. So right now you have to do precisely what is described. You cannot have any views. Elimination of personal information alone does not guarantee complete de-identification. This is an issue that has also not been touched upon. For example, in dentistry, your teeth pattern is your identification. It's called odontology, right? There are many other markers which are not, literal personal information. But from images you can figure out, you can relate the people. So that is not yet, clarified. So the gray areas in the Act pose a challenge for the Indian medical ecosystem and would incur penalties. So that is the current situation. So in the short time, my goal was to appraise you of the current locus standi vis-a-vis the Indian ecosystem for healthcare data. Thank you.